Welcome. My name is Sylvia Chiang, and I am the Director of the Community Health Impact. I oversee the release of the Community Health Impact funding for Mass General Brigham. This is a historical determination of needs funding that we are calling the Community Health Impact Fund, and we are excited to release this funding into the community. So I will let Emily, our interpreter for today, give some instructions for those who would want to hear the presentation in Spanish. Emily.
Thank you, Silvia. Bienvenidos a todos. En un momentico vamos a empezar la reunión y tenemos servicios de interpretación en español. Cuando encendemos la función de interpretación, en un momento van a ver en la parte inferior de su pantalla un icono de un globo. Presionando sobre el icono se va a conectar con la función de interpretación. Por favor, escoge o español o inglés. Aunque usted desea escuchar la reunión en inglés, es necesario escoger un canal, o inglés o español. Si se está conectando con móvil, empuje los 3 puntitos, pues more, pues interpretación, pues el idioma que desea escuchar, y de ahí listo o done. Si tiene cualquier dificultad, por favor comunícase con nosotros en el chat. Disfruta mucho de la presentación. Gracias.
Thank you, Emily. And Patrice, you can turn interpretation on. Thank you. And so now, folks, you will see a little globe under on your lower toolbar, and folks that need to hear the presentation in Spanish will click on interpretation. Good. Okay. We are ready to begin. And I see some familiar faces in the room. Let me share the screen to start a presentation.
Sylvia, can I just add that if anyone has questions, please add your questions into the chat. We will take the questions up in the question and answer period at the after the presentation. So please put your questions in the chat.
Thank you, Mo. And now I would love to introduce our Executive Director of Community Health, Leslie Aldrich, who will walk us through the presentation. Leslie, if you would please introduce yourself. Thank you.
Good afternoon, everyone. I'm really excited to see such a big crowd here today. It's an exciting time. Releasing dollars into community is always a great thing to do. It's also very stressful because, as you can see, and you look around, there is so much great work that is being done, across Suffolk County, across the state. And I hope you all feel kind of the excitement about being in this work together. So it brings me hope, which I think we need every day at this time. So thank you all for being here, and thank you all for being in this work with us and for doing what you do. So I am Leslie Aldrich. I'm the Executive Director of Community Health for Mass General Brigham. I've been at Mass General for 25 years now, really embedded in community health and kind of coalition and collective impact work, and where we all come together to make change. And so let's see what we can do with these funds. I'm going to give you a little bit of a background of what the impact of these funds are supposed to be, and why we have these dollars as a hospital and as a system. So if you don't already know, when a hospital does some type of renovation, construction, we are required by the state to give 5% of that back into the community. And that is that 5% is the community impact funds that we give back into the community. So when there is a construction of the size of Mass General is doing right now, that money becomes very, very large. And that's what we're going to be here to talk to you about. So just go back one more. In addition to the 5%, we also have to give 25% to a statewide fund. Because the 5% really goes to the communities that serve or that are the target populations of the hospital in and of itself. Because there are so many Boston hospitals congested in one area, these DON funds don't or have not historically helped other communities outside of really the greater Boston area. And so there was kind of new regulations in place, which I think is great, which states that 25% of these funds are now going to go to a statewide fund and be used for, Worcester and elsewhere for initiatives there. So the funds all need to be dedicated to our community health improvement strategies. And those strategies are determined by doing community health needs assessments. We do those as hospitals every 3 years. It's a requirement both by the Attorney General, the state, the federal government. But we've been doing it long before that because we know that is the right thing to do. Everything that we do needs to be determined by the community and what's important to the community. And so that is done every 3 years. In our last needs assessment, and in the many, many, many needs assessments that we've done, we always know that social determinants come up as the leading cause of our health issues. This should not be, all of you are in this work and know this, I'm sure, that 80% of our health is really determined by these factors. So we're really talking about our health behaviors, the physical environment that we live in, and everything else that make up our health. Our community health needs assessment and the implementation strategies that we come up with every year collectively as a city of Boston and across North Suffolk right now. We do this with other hospitals. We do this with our colleagues in this space and with residents. And they're also reviewed by a community advisory board. Our community advisory board has been in place, Mass General's has been in place at least for the last, I guess we're going on 6 years now. There will be some rotations that will occur in this next year. But their job is to really look at the hospital's community health portfolio in addition to this determination of need funding. And their main focus is to look at the funding and to choose the strategies, the priorities and strategies that these dollars go to. So as you can see here, when you go back to that first slide, you don't have to go back to it, but that 5% that's going back into the community is right now a total of $62 million. Mass General is building this brand new, it's actually 2 towers, the Susan Reagan building. And it will be done in the next, probably 8 years or so, changing really Cambridge Street. But it is at a tune of $2 billion. So when you're going to do a project of that size, that 5% obviously becomes a lot bigger. We have released money to the statewide fund. So close to $23 million has gone to the state already. And those dollars are going to be released through similar processes as these, just for different locations. So we have $62 million that we right now will be allocating into the community. And according to Department of Public Health, those dollars can get stretched, or how we allocate those dollars will be over the course between 1 and 8 years. The DOM process and how we chose priorities and strategies for these dollars was painstaking. It was done with our CAB, as I stated, and it was really done over an 18-month period. We looked at the data in depth, meeting to meeting, really seeing where the needs were, where the gaps were, what other funding was coming into communities at this time. We were just coming out of COVID as well, so there were some shifts in the data. And that was done really over an 18-month process, along with then meeting, discussing what health priorities should these monies be addressed to, how much should go to each of those priorities, and then drilling down into the strategies and what strategies this really needs to be allocated to. So this is what we came up with. It was, as you can see here, housing at 30% of this kind of $62 million came out at $18 million that we will be giving. That RFP process has already gone out. We are just now finalizing the selection of those applicants. And we'll be making some announcements in the next couple of weeks about that, which is very, very exciting. And then as you can see here, the dollars that we are going to be allocating is the economic mobility and also mental health. Together, that is $30 million. Our release of these dollars right now is only $6 million because we will be allocating more dollars in the years to come. That was how our community advisory board decided to be getting these dollars out. And then there's food and nutrition. We will have an RFP for that probably later this fall for dollars to this priority. And that will probably be a yearly kind of RFP for those dollars. But we're still working on kind of how this will all kind of flesh out. So we're excited about these dollars coming out. I'm really happy that you're all here. The impact of these dollars, DPH regulations always talk about the upstream approach to kind of addressing these issues. And being in this space and doing the work that you're doing now, I'm sure you're all familiar. A lot of the work you're doing is the upstream. The dollars for this really has to go towards prevention, to prevent people from becoming ill, not treating people once they're ill. And so we're very intentional about the types of projects, the types of initiatives that these dollars need to fund. It really needs to go to these strategies to improve the conditions in our community, to improve the policies and the systems that we're working in to have the largest impact. Do you want to jump in here? Or Sylvia, you're going to jump around. So you can see here the two strategies that we will be funding. It is $3 million for economic stability and mobility. This will be around access to employment and education, and around mental and behavioral health. Really thinking about how we are going to improve access, but also how to prevent people from needing to get treatment, needing that treatment. So I think, Sylvia, you're going to jump in here. No?
Yeah, I would love to go into detail, in a little bit into detail on the priorities and strategies. We are, again, on this round, funding economic stability and mobility, and mental and behavioral health. They might overlap a little bit, but let's dive in a little bit. So in economic stability and mobility, I think some of you in this room actually are the experts. You know your communities well and understand what occupations and careers are necessary in your community. At the same time, you hold the information of the potential or available workforce. They might be either unemployed or underemployed. And also understand that these groups don't usually have access to gaining skills and education in the traditional way our systems are set. So we need to be innovative and creative. How do we increase or enhance the skill and talents of our workforce that is either unemployed or underemployed to occupy actually those careers and occupations necessary in our communities? And that's where we want you to bring new ideas into. Is it apprenticeships and workshops? Is it training or enhancing skills during the workday, allowing people to maintain a salary? Is it job promotions and job growth? Once they are at an entry level, they can grow or climb the ladder in their position, increasing their capacity for financial stability and mobility. And so the other strategy is wealth building and loan entrepreneurship, and it is understanding too our communities have a migrant population that is actually proven to be highly entrepreneurship. We see our folks actually cooking out of their home and in their kitchens, and or just having many ideas for businesses and way they would like to sustain themselves. But again, they don't have access to the traditional ways for loan and capital investment. And so how do we address those barriers and do allow and provide a loan and capital investment to populations so that they can have their own little small business, at the same time that coaching and mentoring for financial growth, success, and wealth building. So those are the two strategies on this current round. Eventually next year, we will be investing in multilingual workforce. And in that case, we will be diversifying our workforce and seeing multilingualism and bilingualism actually as an asset and not as a barrier for some of our populations to be able to provide services that are so in language capacity that is so needed in our communities. That's the economic stability and mobility for mental and behavioral health. Although it is a clinical component, we are, again, you know what Leslie was saying, focusing on the upstream and the social determinants of health, this time with a mental and behavioral health focus. So what, you know, we would like and DPH would like to see is that in your proposals, you have a clear and show a clear understanding between the connection of social determinants of health and mental health. So, for example, and partnerships are encouraged. If you are a service that provides housing stability, then how are you going to partner up and or enhance access to mental and behavioral health in order for your clients to be able to sustain or maintain their housing? Same as employment, being able to obtain or maintain their employment and through support of mental and behavioral health. Those partnerships and that wraparound service will be increasing access to mental and behavioral health in the community setting. So that's what we're looking for. That innovative youth well-being intervention, which is the second strategy, is being more intentional towards the younger generation. Again, the connection between youth and their social determinants of health, a lot of the time is about education. So partnerships are between schools, not necessarily if you have access to youth in any other way, but again, a connection between their mental health and some of the social determinants of health. And my computer is a little frozen. I am trying to move to the next slide. Okay. On the next slide, we just have a little list of, and I don't know why it's frozen. There we go. A little list of some aspects we've been having conversations with our current allocation committees on what is it that they value and what is it that they're looking for. So these are some of the things they've been mentioning. They would love to see your proposals having sustainability. They want to see justice and fairness, equity, centering those voices that are usually not centered. Community driven, very important, but I know you are that organization that is very much community involved. Just make sure you show that on your proposal. If you are responding to any youth strategy, make sure that youth is involved in the formation of your project or proposal. Open-mindedness and definitely collaborations. We are wanting and encourage partnerships in these applications. Good. So it's a pleasure to introduce Mo Barbosa. Mo is our partner in crime, although no crime is ever committed here. He is our grant facilitator of all our meetings, and he just, you know, is a great, an important member of our team. So Mo.
Thank you, Sylvia, for that wonderful introduction. Wanted to spend a little bit of time talking about eligibility. And also to flag for folks that we're going to answer all of the questions after the presentation. So please keep putting them in the chat. And if things get answered along the way, then even better. So some of, I think, what folks are asking for, we will get to it as well. So eligibility. So eligible for award are nonprofit organizations, municipalities, and educational centers that serve Suffolk County. Municipalities includes the various units of government within a city. So if you're a department within a city, for example. The cities themselves are within Suffolk County. Any neighborhood in Boston and all of the neighborhoods of Boston, Chelsea, Revere, and Winthrop. That is the geographic focus and limit of these funds. The organizations need to do the work serving these communities. You don't necessarily have to have an address in those communities to be able to apply, but the work has to happen in those communities. Projects from the above organizations responding to one or more of the listed strategies. And so what you've seen in what Sylvia and Leslie mentioned were the priority areas that are being funded and a certain number of strategies that are going to be the focus of the RFPs. And if you've had a chance to go, focus of the LOI. If you've had a chance to look at the LOI, it specifies which of the strategies we are putting out for funding. And we'll spend a little bit of time going over kind of the how much to what and so forth here today. Not eligible are internal Mass General Brigham affiliate community, clinical, or research departments. So if you are part of MGB in any way, shape, or form, you are not eligible for these funds. Coordinating organizations for the Community Health Improvement Plan. So if you are one of the coordinating organizations in Suffolk County on the Community Health Improvement Plan, you're also not eligible. And then projects outlining direct service, transportation, reimbursable costs. These will be clinical costs for accessing care with the hospital. The intent here from the Department of Public Health is that these funds are not used to just support folks accessing care at the hospital. It really is to go upstream, changing the conditions that impact the things that people are facing. So nothing that is directly servicing the clinical aspects of the hospital should be included in this funding. Next slide.
Hold on.
Yep, no
There
worries.
There we go.
All right. So there are two funding areas. Economic stability and mobility is one of the priorities, and mental behavioral health is the other priority. Within economic stability and mobility, two strategies are being funded in this funding cycle. Strategy A will have $2 million available for an estimate of 8 to 10 awards. The maximum amount of an award is $300,000 to be used over 3 years. Indirect costs are capped at 20%. This means that the max is $300,000. You should apply for dollars that fit the work that you are doing. And we say that out loud because that becomes one of the things that people have to look at in the allocation process is does the ask meet the actual needs and the work that's being talked about. Strategy C is $1 million, and that's for an estimate of 10 awards with a max of $100,000 to be used over 3 or 4 years, and indirect there at 20%. So just to make sure we're all on the same page here, when we're talking about the economic stability and mobility, when we say strategy A, we're talking about the innovative workforce development, which is adopting innovative workforce development strategies to train low and moderate income residents as well as returning citizens through programs such as apprenticeships, as well as promotion training of new careers, such as community health workers and community liaisons, childcare specialists, etc. When we say strategy C, we mean training on wealth building and business loans, providing entrepreneurship with community, with training on financial management and sustainability, how to establish wealth and financing new businesses, e.g. new childcare businesses, etc. In the LOI, it gives you the full description of these strategies, and feel free to use the Q&A to ask any questions about those as well. That is one priority. The second priority is mental and behavioral health. And in mental and behavioral health, we are looking at two of the strategies. The two strategies are strategy A, which is focused here on, I'll make sure I say this correctly. Well, strategy has $2 million available for an estimate of 8 to 10 awards. Max amount awarded up to $300,000 used over 3 years, with an indirect cost capped at 20%. Strategy B is $1 million available for an estimate of at least 13 awards. So think about the max award here, it'll be about $75,000 to be used over 1 to 2 years, with the max indirect costs at 20%. So strategy A is expanding behavioral health services. So here is increasing community-based behavioral health centers and other similar initiatives, such as restorative justice and community-led behavioral health initiatives, group work for substance use disorder and trauma-informed care, with emphasis on Black, Hispanic, and non-English speaking individuals. So that's kind of an example of what you might do with those funds. And then innovative youth well-being interventions, things that engage schools in health and wellness programs, that exercise education, substance use disorder, and mental health prevention and interventions. And as it reads, it really is about innovative youth interventions. So being able to propose something that maybe is a step in a different direction or something innovative that you have some evidence of that it will work, and being able to expand on that, or doing something very new that shows promise. Again, the LOI process allows you to put forward these. I want to talk a little bit about how that LOI function will work, and also what you need to do to get it in. So if you want to go to the next slide. Wonderful. So no other documentation required in this stage, so you'll just need to do the letter of intent. You can do more than one project, so you just need to do a separate letter of intent for each project. So if you are an organization and you're thinking, oh, we are thinking about X project or Y project, and you want to put both in, just put them in a separate LOIs. Written instructions on how to access the letter of intent in Monkey Survey Monkey Apply. We always get that mixed up. I always say it wrong also. You can scan this code there and you can get into Survey Monkey Apply. You can also email Sylvia. Hopefully you've had a chance to actually go on the mini site and are able to pull up the particulars for each of these programs. They also outline the timeline, which we'll go over next, but I wanted to make sure that folks were aware of the evaluation criteria. This is how we'll be evaluating the submissions here. So does the project address one or more of the strategies outlined? So it's really important that you're able to look at the strategies and address one of them directly, one or more of them directly. The project addresses the needs of priority neighborhoods and areas. So we have outlined some of those areas, and also you have access to documentation that allows you to make a case for a particular neighborhood and a particular need. The project impacts the policy systems or environmental change. This is really important because the projects need to go upstream, as Leslie mentioned. So it's not about addressing the problem after it's in place, but really addressing the conditions that create the problem. The project addresses equity in our communities by benefiting disenfranchised groups. Really important that you're able to describe how what you're doing is going to benefit disenfranchised groups. The applicant reflects the capacity to manage and implement the project. So this should be within the scope and size of what your organization can do. The impact of the project aligns with the cost. So making sure that you're using the resources in a way that really benefits what you're trying to get done, and does so in a way that is a good stewardship of the dollars. And the project outlines a strong community engagement process. So you have a space where you are engaging with community, and community is informing what it is that you're doing. So these are the evaluation criteria. This is how folks will evaluate the LOIs that are submitted. I want to next talk a little bit about the calendar, and then we're going to have an opportunity to provide you some guidance on how to access the system itself, and then we'll take up all of the questions. So today is the information forum for the letter of intent. So that's May 1st. The letter of intent was released last week, or a little more than last week, April 22nd. The due date for the letter of intent is May 17th. So you need to get in the letter of intent by May 17th. Selected applicants will get notified before the end of June. And that's just to tell you that your LOI has been accepted, and we are going to move you forward for the RFP, the full request for proposals. The release of the final request for proposals will also be at the end of June, and this will be when folks who are selected to move forward would receive that RFP. There will be opportunities for support, technical support with the RFP. We've done in the past things like office hours and helping folks really think through the things that they're trying to put forward, or if you're having trouble putting things into the system itself, there'll be opportunities for you to get some technical assistance during the period when the RFP is released to when it is due, which is the end of July 2024. And then we expect notification of awards to be near the beginning of September 2024. That is the calendar so far. And I want to say that while it is the intent to line up exactly with what has been listed here, we all are subject to the changes and swirls of time. So we'd like to stay on this calendar, but we acknowledge that things may move in different directions between now and then. With that, I'm going to send it back to Sylvia, who I believe is going to introduce our next presenter.
Thank you, Mo.
Thank you, Mo.
Yes, I'm getting a little bit of feedback. I'm not sure why. Now, next we have Quinn. Quinn is from our evaluation team here at the Center for Mass General Brigham Center for Community Health Improvement, and she will walk you through how to start your letter of intent on the SurveyMonkey Apply platform. I know some of you might have already started it, and that's great. We do have some applications on the works on the platform, but here is Quinn, and then you will also have opportunities for any questions.
Thank you, Sylvia. Hi, everyone. I'm Quinn. And Sylvia, would you be able to enable me to share my screen as well?
And I think that's Patrice. Patrice, if you
Hi,
would
Patrice.
enable Quinn.
Thank you, Patrice.
Do you need me to stop sharing?
It's okay. As long as I'm able to share, I'll be able to. Okay. And I will share my screen. Hope everyone is able to see this. And so I just want to go over really briefly, once you're in the SurveyMonkey Apply platform, what it will look like. If you haven't registered yet, I just want to show first where folks can go directly to do that. It's pretty straightforward. We have the instructions for that on our website as well. And so you just go ahead and go here and register, and it'll walk you through the steps, of course, and then you'll receive a confirmation email to verify your email address. And from there on, you should be good to go. And so I just want to go show first to everyone what it will look like when you first go into the platform. And of course, many of you have already begun your application, and so it should be no problem for you, but just to show that we're all on the same page. So since I have access as administrator or as an applicant. And so when you first go in, if you haven't started an application, this will be the first view that you see. And then you can click directly into programs. And this is where you'll see the 2 live LOI applications here. So whether you're going to go for economic stability and mobility or for mental health, you can go here. So for our example today, we'll just do economic stability. And then from here, of course, you click on apply, give it a name. This will prompt immediately, and this will be the name of your project title that will be linked to your application from here on out. So this is where you can start thinking about what the name would be. And then here, you click directly into letter of intent. And this will take you to the full application. And here at any point, you can click on down below, save and continue editing. So you can always come back to your application and of course advance if you've completed out all the fields. If you do need to switch to Spanish, they have the capability up here, and you can click up here where the caret is and switch to Spanish. And there'll be full translation of all the fields for the letter of intent application as well too. You can toggle back and forth as needed as well. There's just a few reminders. There'll be fields where you have to enter something and it will not allow you to advance if it's not completed, of course. And you can fill out all the details about your leadership as well. Any contact information. So I'm just going to fill out some test ones for now, so that we can show everyone what the whole application looks like. Just give me a moment. And of course, if you click on Boston, you'll be prompted to specify which neighborhoods are Boston. So you can go ahead and put anything that you need here. Picking which strategy. So this is for economic stability and mobility. So you have strategy A, C, or a combination of both. This, of course, will be different for mental and behavioral health. You'll have the option of picking the strategies there as well too. And most of these questions are all the same between the two priorities for the LOI applications. The only difference is the strategy and of course what the content of your application will be. There's just quite some test answers. So I just want to get to the end to show folks what would happen if you mark it as complete. So when you get to this point, you can save and continue editing and return back to your application at any other time. But if you are done, you would click on mark as complete. And just to be aware that once you do this step, within your application, you can't really edit directly back in the application anymore. That function's not really enabled right immediately. And so there's a trick to get around that. If you did need to click on mark as complete or you did it and you need to go back, you just go directly up above here and there's the 3 dots. Some folks you may be already aware, but I just want to bring up that there is this option here. So you click that there. You want to erase all your answers, you can go ahead, click reset, or you can just click on edit. And now the task is reopened. You can go back in and edit as needed as well. So there's some self-service there to be able to do that. But once you're satisfied with where you are, mark as complete again, and then you can click submit. And this will allow you to submit your application. You should receive an email confirmation as well. Sylvia will also receive an email confirmation. And that's really it. But if you have any further questions about needing to make further edits, you can definitely reach out to our team here and we will be able to reopen your application if that was necessary. You can go ahead and repeat those steps how you went into the letter of intent. Click on those 3 dots and be able to edit your application. But that's really it. And then at this point, you can, of course, continue to apply for another LOI if necessary, or a different strategy. You can go back in, but you can always go back to my applications here and see what you have originally submitted for your application, and you can see your responses as well. So it's pretty user-friendly. Hopefully there shouldn't be too challenges along the way, but if so, please feel free to reach out to us and we can definitely assist you.
Queen, I would just like to highlight to the group that always make sure to hit submit. We have past experience where people have marked as complete and not submitted the application. Unfortunately, that will not push it through the process. and will not get reviewed. So just highlighting, you need to hit submit.
Yes. And also, you know, if you don't see immediately within your inbox, of course, check your junk email box as well too, just in case it might go there. And also, I want to also bring up that you can also switch to Spanish here once you're in the program for each of the priorities, and we'll have the translation there available as well. And the description here has all the background information and also the other additional links that you can click into to get more background information about the DON itself and as well as the priorities that are being released. Thank you.
Thank you, Quinn. And if folks have questions about that portal or accessing it, please put them also in the chat. We have a number of questions. Some of them are questions that were directly sent to me as well, and some of them were sent to the whole group. So I'm going to go through the questions in the order that they have arrived. So if you don't see a question up there that I'm naming, it just may mean that it was sent to me individually and not to the whole group. Answering the questions will be the ones that I can take myself, I'll take, but I'm really relying on the wonderful folks from MGB, Sylvia and Leslie, to help us with the majority of these questions. So we'll get started and we'll go through the questions that have been submitted first. And then at the end, if there's time, we'll open it up to see if there are any questions that folks want to give voice to that they didn't put in or that weren't answered here. And just for the folks who are following along and joining us in Spanish, you can put the questions in the chat in Spanish and we can translate those as well. And our interpretation, you can also give us if you want to interpret them and put those in the chat, we can take it that way as well. So first question is, are public schools allowed to apply? Do I call you Dr. Aldrich? No, Executive Director, yeah.
Doctor.
Leslie.
Far from that. Of course, yes, public schools can apply.
Awesome. Would funding for health trainings outside the ones listed in the RFP be eligible, such as clinical medical assistant or phlebotomist in the workforce development? And I'd say that's a yes. I think you'd have to make the case for how this would fit what the criteria is in the strategy. Is there an interest in partnerships between public schools and community organizations? I believe so. I don't know if Leslie, if you want to say anything on that.
I mean, so yeah, there's always an interest in partnerships. Anything to make a larger impact, I think would be great.
And in the mental health one, the second strategy specifically calls out innovative strategies with young people, and that ability to partner with schools might be a way for you to demonstrate that you're going to be able to actually do the thing that you're trying to do. Someone wanted to know where the pie chart comes from. I believe this was the pie chart about the things that impact your health. Our friends at Robert Wood Johnson Foundation has done a version of it. There are several versions of where that comes from and the research that backs it up. Thank you. Will we be sharing the slides after?
Yes. Yep.
Slides will be shared on our website. All right. One question was, how far upstream are you willing to think about economic mobility? Do you see K-12 education as part of this? I think if you look at economic mobility and some of what they're asking there, I think the upstream is more intended for workforce issues, not necessarily the education prior to workforce. I don't know if Leslie or Sylvia want to say something more about that.
Yeah, with those particular strategies, yes. I would say it's more about the workforce than about youth.
Right.
How did you want to address, oh, sorry. Leslie, that was your question to me. If we have a program that will focus on addressing both mental and behavioral health and physical health together, would the program be eligible for funding?
So yes, they will be eligible for funding. The hard part, and this might be a couple of people's questions, so we jump in here. Should I apply if it crosses over both? Should I apply for one or the other? You do have to pick. There's no mechanism in here to pick both mental health and economic mobility together. So you really have to think about what your main outcome is, what you're striving to do, and then choose that strategy and go all in.
Choose that strategy within the
That
priority area.
Right.
What's the question about mental and physical health though, Mo?
Oh, I'm sorry, then I answered that incorrectly, but I think you all asked that question anyway. Right.
It is mental and physical health, and Leslie's point about what is the intended outcome, and make sure that you match that intended outcome with the strategy that it should go under is important. And as always, you can make the case for how these are intertwined together. Are you thinking about citywide and or neighborhood specific investments? I believe here the answer would be both. And definitely where it is that you can make the case about your impact, that would be what we'd want to hear from you in the LOI. Would youth development programs fall under economic stability and mobility? And to the extent that they are related to workforce development and moving folks into career and life-sustaining jobs, I think you'd have to make the case for how that youth development program was aligning folks with an economic stable future. Alessa, do you want to say anything more
No,
about that?
yeah, I think you just have to show your intention in that.
If we applied for funding under the housing strategy, can we also apply to be considered for funding under these strategies?
Yes.
Yes, resounding yes. So if you have applied under housing or any other spaces, you still can apply for these strategies. Can we only apply with existing program, or could funding be used to develop and pilot a new program? So for specifically the innovative youth interventions that by name is calling out that you can develop and do something new, I think you'd want to make the case for, in the other strategies, you'd want to make the case for why this thing you're proposing is a promising practice, or how it's been done in other spaces, or what you see that would be really good about it doing that here. Leslie, do you want to say anything else there?
No, just say that, I mean, overall, yes, it can be new. You just have to have the evidence and convince an allocation committee who knows this space well that this is going to be successful, right? So you gotta have that background.
Would work to better integrate public health into primary care at a community health center at a policy protocol level for this. Could someone be funded to integrate
Mental
public
health.
health into primary care at a community health center at the policy protocol level?
That's a tough one. I would say that would be hard to do. These funds are really not supposed to go into direct clinical services being done in the clinical setting. The policies and systems is an interesting spin on that. So we might have to get back to you on that. You know, my gut is that would probably lead more into the clinical care, according to Department of Public Health, and changing kind of practice in that way.
My advice to do would be to think about it at the policy level outside of any one particular community health center. So if it was policy that would affect community health centers as a whole serving in this space, that might be something that would be allowed by DPH.
Right.
Can you clarify the nature of partnerships required? For instance, to address social determinants of health, we partner with food pantry, but have them as a resource versus allocating budgeted funds to provide food. Also, please clarify the total funding versus annual. So we've done the total funding versus annual clarification. We went over those. Hopefully that was for folks, we'll repeat them at the end. But in terms of the partnerships required, to the extent that your partners are part of getting to the result that you are working on, whether they are receiving funds as part of this proposal or not, is up to you. I don't know if you want to say anything else, Sylvia or Leslie.
Yeah, you said it right, yes. You know, the stronger the partnership, the better. And usually if the funding is shared, usually that's a much stronger relationship, but if it works, works.
For mental behavioral health strategy, would you consider proposals that focus on training the people from the community to become clinicians? It overlaps with the occupation and mobility strategy.
Yes, I would say that might be more of an economic mobility strategy than it would be a mental health strategy, however.
Mhm.
So I would opt to do that.
So I encourage you to apply in that space,
Yeah.
that strategy. Can MGH clinical department be a partner? Can an MGH clinical department be a partner?
It can be a partner, it just can't receive funding.
That's a partner
And
that cannot receive funding.
not receive funding, and the work that you're doing cannot be about their work.
And
They
that's-
can be about supporting your work.
Right.
Are indirect costs included in the total cost maximums at 300,000? Yes, they are. They're part of your award. Can a request include capital needed to create innovation and upstream change?
We always get this question, and I know other grant dollars, usually capital expenditures, like are not included. I think we have always said we want to be flexible in this. I do believe agencies need funding to do lots of different things, and most times dollars don't support that. So I think it's okay. It can't be the majority of, obviously, of the request.
There's a question about the list of innovative items of work. If you look in the actual LOI on the SurveyMonkey apply sheet, it will give you some of those examples that were listed there. Could an organization apply for and be awarded funds for more than one strategy? Yes, you can apply for more than one strategy. It'll be up to the allocation committees about what they decide about making awards for an organization in more than one strategy. But you definitely can apply for more than one strategy. Leslie or Sylvia, do you want to say anything more about that?
No, I think that's fine. And you can apply to more than one priority. You can apply to both priorities, different strategies. We have two separate allocation committees. They're different, members. So they're coming at it with different lenses.
For mental behavioral health strategy A, is focusing on substance use disorder or trauma-informed care a requirement or just examples of what the grant can be used for? Great question.
Just
So
examples.
that's example.
Exactly.
Just examples. Yep. With partnerships encouraged in the guidelines, will coalitions be scored higher, or would funding for a single organization to enhance work with a variety of partners, BPS, other youth development orgs, mental health clinicians, etc., be equally weighed for mental behavioral health strategy B? I would say to you that the power of those partnerships to get done the thing you're trying to do is what we want to see, and that's the scoring that we'll be looking at is, are these partnerships in the service of what you're doing? I don't know if Sylvia or Leslie want to say anything else there.
No.
Could a public higher education institution not in Boston but that serves students from affected communities apply? So educational centers that serve Suffolk County are eligible to apply. So you don't have to be in Suffolk County, but you have to, your service has to be to folks in Suffolk County. And to the extent that you are able to show that the funds would be in the service of those folks in Suffolk County, then you'd be eligible to apply and be considered. I don't know if Sylvia or Leslie want to say anything else on that.
No, I mean, it's just, there will be an evaluation component that will be required of this, and we are going to actually hire evaluators to work with all awardees. So you will have to have that specific kind of outcome measures. If that's the case.
Does seeking input from school staff and administration count as community engagement for purposes of meeting the selection criteria of strong community engagement process? I think the allocation committees would favor you having input from community members who are not staff of programs and institutions. I would say if you're working with schools, definitely having input of school staff and administration is a good thing. It doesn't substitute for having community members and residents input. Anything
That's
to add? Go ahead, Sylvia.
No, that's it. Yeah, I would say more than staff would be best.
Are letters of support or commitment required for the LOI?
Not
Not for the LOI.
not for the
Oh.
LOI.
When does the funding period begin?
Very good question. I think our
So
timeline, yeah,
we have a calendar that says that we're looking to do the notification of awards at the beginning of September. So directly thereafter would be when you'd be able to start using the funds. The notice of award would be when you would know that you had it. So we'd encourage you to not start spending money with the expectation of getting the award. And that when you get the award, there's obviously some contractual things that you have to do to be able to use the dollars and receive the disbursements. So I would plan to have a little bit of cushion time after the award before you start. Any advice that you would add there, Leslie or Sylvia?
yeah.
May I submit a proposal for each strategy? I believe we covered this, that you are able to submit an LOI for each idea in each strategy. And if you have more than one project proposal, to put them in separate LOIs, even if it's to the same strategy. Would a proposal funded during the previous DON be eligible?
Definitely.
So that's a yes.
That's a
Yes.
yes. Oh,
Yes.
sorry. I thought it. Yes.
Just want to make sure we get it into the record.
And it'd be great to highlight that actually, yes.
Right.
Can a fiscal sponsored organization apply?
Yes, there's an option of being an applicant and needing a fiscal sponsor. Yes.
Mhm.
So if you are an organization applying and you have a fiscal sponsor, you want to list their information there. So that works.
There's
How do
room
we get
on
a
the LOI.
How do we get a complete list of LOI questions in advance of completing the form? I believe you can enter the portal and you'll be able to look through
Download.
the questions.
The three
Um,
little dots that Quinn showed has the download option. They can download the application.
Yeah, and you can download the application there, so you'll be able to review them. For economic mobility strategy A, are there age restrictions? The careers offered and examples indicate only jobs that have a social impact are eligible. Is that accurate?
Yeah. Will you read that again?
Sure. For economic mobility strategy A, are there age restrictions? And the careers offered as examples indicate only jobs that have a social impact are eligible. Is that accurate?
No, it could be anything that is going
Right.
to get, so the age, answer that question, there is not an age limit. And professions can be anything, anyone that is going to be, kind of a wealth building, career building job.
All right. And if there's some backing data of the need
Mhm.
in the the community they're serving, that's best. Why that particular career?
If an org clicks on apply for strategy A and C, would funding from both strategies be available to the org? So the way that this gets determined in the allocation process is that depending on how many organizations apply in each of those and what the preponderance of the work that you're doing, you'd get placed into one of the decision processes for either of those strategies. And then if the proposal is moving forward, we may have funding come from both of those cost spaces or both of those strategies as dollars. But you have to actually move into being eligible, or you have to have a winning proposal for those decisions to then be made about where the dollars are going to come from. Right. Are we allowed to apply both strategies? Yes, we've said yes to that. For economic mobility strategy A, would a workforce development provider need to submit a proposal proposing healthcare jobs, or is it open to IT jobs in general with an average salary of 52K? Yes,
Any job.
any job.
Mhm.
To clarify, we would be applying under the mental health category, but the program also promotes physical health. Absolutely.
Mhm.
Good. In partnering with another organization, will MOAs be required? Will a memorandum of agreement be required?
Not for the LOI, but for the RFP.
RFP phase, yeah.
Still unclear about economic mobility. Can a case be made for youth development programs leading to economic mobility? I'd say if you can make the case for how a program will lead to economic mobility and stability, put that into your LOI and it'll be considered. You want to make sure that you're able to make the direct connection that the allocation committee will be able to follow for what you're doing and how it leads to that economic mobility. Can a large agency with multiple divisions submit multiple LOIs for the same fund and strategy? For as long as they are different projects, you can submit different LOIs.
They all compete against each other, though.
They will compete against each other. Thank you, Sylvia. Absolutely. All right. For mental and behavioral health mechanisms, strategy B, would suicide prevention efforts targeting at-risk youth be considered, or are you hoping for prevention before mental health problems exist? I believe the language I heard was prevention before people are ill.
Mhm.
So suicide prevention by definition would be the prevention, would include the prevention that we're talking about, especially if you're doing things that lead or address suicidality in the broader community, or a community that has a disproportionate risk of suicidality.
Okay.
If that helps. Economic mobility. Can an organization that has specialized workforce development program for homeless or formerly homeless adults that trains people for careers in food service and housekeeping positions, including hospitals, be eligible? Would higher priority be given to programs training for health careers?
You won't get higher priority for health careers, but it's a great project. Sounds just standalone, doesn't have to be healthcare.
So just to be clear, there is not a need to, or you don't get more points for it to being in the health careers at all.
Right.
Economic mobility strategy C, the frequently asked questions lists schools and businesses help students get jobs as eligible activity. Could this apply to community group working with businesses to secure internships?
Yeah.
Was a good and strong yes. I like that. Very clear. Thank you, Sylvia. Where and when the recorded video will be available for us? When will the video be available, and where will they be able to access it?
I would say maybe Patrice has a better idea from our communications department. Not soon enough, I think.
In the next couple of days, yeah, we're gonna edit it, make sure we all look good. That's most important, right? And and then we'll get it up on our website. That was a joke for anybody.
It'll be available on the same website where you're able to download all the other information.
Exactly.
In as many as media channels we've been promoting all the information.
If you go onto the MGH, if you type in community health in the search, you will see, or MGH Community Health Impact Funds. Our website should be in all the materials, but it will pull up, and then you'll see information about all of these funds. So it will be up there.
With regard to allocation of funds, should the project proposed be aligned with a 3-year budget? It depends on the strategy. If you notice, each of the strategies had time periods that were with them. Most of them were 3 years. Strategy B in mental and behavioral health was 1 to 2 years, and strategy C allowed for 3 to 4 years. You should do a budget that provides for the length of time of the project that you are proposing.
Okay.
Let's see, appreciation, some thanks. For organizations that are funded, will there be requirements to attend fora or meetings related to the grant?
So that is another really good question. So as I said, we will be hiring an outside evaluator to help with everyone. We have heard in the past that grantees really do like to come together. Sometimes people can say, oh, that's kind of an obligation. I don't want to go. But in the past, people really like to share their ideas, their stories, kind of learn from one another. We do want to do that. I think it's important for the field in general. There's not enough of that sometimes. And it helps us too, to be able to learn what we can be doing better and how we can be involved as partners, not just as funders, because we're in this as well. So I would say, yes, that's a long yes to that. We will have a couple of sessions for us to come together.
There's a question of the interest in partnering with BPS. I think we covered that earlier, that if you're doing something that focuses on students, and that would be a strong partner for what you're trying to do, then it makes sense to list them or to have a partnership with BPS. There's a question about, can funding be used to hire new staff member to expand capacity of a career development program, to the extent that that career development program and that staff person is doing the work that is under the strategy, and that you're demonstrating that this gives you the capacity to address the upstream focus of the program. That makes complete sense. You have a broad, kind of opportunity for how you use the dollars. You just want to make sure that you're presenting why that use will get you to the intended outcomes. Would supported housing in conjunction with case management and behavioral health support for formerly unhoused individuals be eligible for the mental behavioral health strategy?
Yep.
Yeah. So.
Yep. Okay. And are you interested in how early childhood education can support longer term success for economic mobility?
I know.
It's
I
a-
mean, we are in general, like I am. But for these funds, I think it really is about how we're going to show the impact of this in these couple of years, right? So that's a hard one.
If you could make the case for a policy change that that would affect the economic mobility of a family, including how that
Yeah.
early childhood education support would allow for family members to take better jobs, access education, training,
That's how I'm
etc.
thinking it too.
Yeah, it's
If
a
you
good.
can, yeah.
Maybe that
You want-
angle to early childhood education,
Mhm.
then the ability of parents to be in the workforce.
Yeah.
You want to make the case for how what you are putting forward would lead to that economic mobility in the near term.
Almost generational.
Right.
Yeah.
Well
Yes.
said. Yeah,
Impact the children, but an immediate impact on the parent,
families. Right.
on the caretaker. Yeah.
Yeah.
That is the end of our written questions. I'll ask if there are folks who wanted to follow up on a question or have a new question. I'll ask you to raise your hand using the hand raising reaction that you have. There are tools that allow you to raise your hand, I believe. I'm hoping. Or you can physically raise your hand. Say, hey, Mo, I have a question. We'll take any of those. Let's open the floor for any questions. All right, Howard, go ahead.
Yeah, hi, can you hear me?
I can, go ahead.
Okay, good. So my question is, trying to get clarification on the notion of upstream and how it has an impact downstream. If we intend to run certain therapeutic groups that address certain mental health issues and other kind of social emotional issues and things like that, that can be seen as like direct service, but really mental health, addressing mental health problems is an upstream. Mental health is an upstream factor in a whole host of other things that might follow, right? If you've got poor mental health, you're gonna have trouble in school, later workplace, relationships, all that. So I guess what I want to know is, if we are looking to get funding to run more of these groups in the public schools, will that be qualify as an upstream? Or will that, address the upstream requirement, or will that be considered just addressing mental health? You know what I mean?
Great question.
Yeah.
I don't know if Leslie, if you want. So I'll say something and then I'll ask you to jump in.
Yep.
Howard, to the extent that you can make the program address an unmet need of a disenfranchised population, and to the extent that there is a inclusion of providers or development of providers for that population, that might be a way to go upstream, kind of in the more like workforce and who's doing the work space. If there is an innovative youth intervention, then I would probably say look at strategy B in mental and behavioral health for that innovative youth intervention, that might fit better what it is that you're proposing. Leslie, do you want to opine on that?
Yeah, I would just say it is a really good question, and this upstream is hard to wrap your head around, and mental health, it in particular, because you're right, Howard, mental health can be just seen alone as an upstream approach. There will be, I would take Mo's advice here. I'm imagining a lot of LOIs that come through, projects that come through will have that downstream component. That will be okay. I think DPH understands that that's a need right now, right? This is what we're faced with right now. So we will take that into consideration, but really do try to think about innovative ways to be meeting populations that can't be served, haven't been served, what the gaps are, rather than just continuing with existing programming as is.
And two things they should highlight in the application. What is the system change? Was that organization not capable of providing this service before? And what is changing now that you will? That is a system change within the organization. And two, the connection with a social determinant. If this is going to improve education attainment, then make sure to make that connection, and that you will be able to prove and enhance the connection of mental health with that social determinant of health, which is education.
That's great. Thank you very much. Real quick follow-up question. Restorative justice and restorative circles, they've been around for a while. Are they still considered innovative, or not?
Yeah, think about the population, the disenfranchised groups, and to the extent that those have been available or used with those populations. That might be a way for you to get into that space.
Right.
Leslie?
Yeah, I would say the same thing. And if they're not used at all and people are familiar with it in that area, then it's innovative there, right? So, I think that's fine.
Okay, thank you very much.
David,
Yes, apologies if you already addressed this previously. Just on the staying with the mental health and the requirement that it is engaging with schools. Just wanted to kind of get a little more clarity on what that might mean, or if we could a community-based group could work in that space without really engaging with the school system.
I don't think there's a requirement to engage with the schools. But I think where are you getting your referrals? What's happening when youth are in schools, or that, yeah, I'm not familiar enough with the project that you're proposing, but is there anything that you're doing that can also kind of spill into that school space? Since that's where, kids are spending a good portion of their day, but it's not a requirement that you.
Okay, I got that off the FAQ. It
Yeah.
says engage schools. So maybe that was just
Right.
an example.
Right.
Okay, thank you.
thank you, David. We've got a question in the chat. For non-healthcare and IT training programs, are you specifically looking for apprenticeships? Would pre-apprentice models qualify? Apprenticeships were listed as an example, so we're not specifically looking for apprenticeships, and pre-apprenticeships models would qualify as well.
Yes.
All right. Any other questions? And again, feel free to raise your hand, put up you can use the emojis, or you could also just come off mute and say, hey, Mo, I got a question.
Mhm.
Any questions at all on the eligibility, on what the dollars are for, how they're going to be dispersed, on the LOI itself, accessing the portal? Any
Okay,
questions?
I have a question.
Go ahead, Aisha.
Hi, everybody. So nice to see you. I think I'm curious, when you think about how these system level changes happen, oftentimes partnerships are really well supported by a convening entity that then supports kind of backbones, a number of different partners that do direct program service and delivery. Is that something that you would see as being valuable, and you're open to being part of these types of applications?
So yes, most definitely.
Great, thanks.
Mhm.
Got another question in the chat. Which fund strategy would you say a youth internship and training program in Chelsea for migrant and bilingual youth ages 16 to 21 would fall under? So which fund or strategy would a youth internship and training program in Chelsea for migrant or bilingual youth ages 16 to 21 fall under? I think it would be what is the intent of that program, and what are the intended outcomes. That might help you to decide which one to go under. I just want to see if Leslie or Sylvia, if you want to give any guidance there, or would it make sense for them to come to an office hours or something to talk more directly about their program?
Definitely depending on the outcome, which it's not mentioned here, but I was thinking workforce development.
Right. If you'll find it harder to track kind of mental health outcomes for this population, then I would go with the economic mobility.
Someone wanted just a little bit more on the requirement for upstream, downstream approach and model, and what this means in terms of what we're looking for. The Department of Public Health requires that DON funds be used to address the upstream causes of what it is that we are seeing in society and the needs that are identified by the community needs assessment. So the work should be about making change at the policy, systems, and environmental level, and not just providing care after a problem or illness is in place. And really not just ameliorating what's already there, but really making durable changes that last beyond the money or have impact beyond the dollars invested. So it's not paying for a program that provides a specific service. It is really about addressing a problem and making a change to how that problem affects the community that it is affecting.
Mm.
Hopefully that helps. Other questions? Any other things you want to ask?
Yes.
Go.
My name is Dalwin Corsino with the Mass League. I just have a quick question. Would a partnership with another Boston-based organization, so still in Suffolk County, be viable while us using resources from an organization outside of Suffolk County? Oh, does that make sense? So we'd be partnering with a Boston-based organization, but our pipeline program would support youth to pursue MA, DA certificates at another health center outside of Suffolk County.
So the people who are being served and benefiting are people who reside in Suffolk County.
Correct.
Then you are eligible, yes.
Thank you.
Other questions? I think Elizabeth is getting a call about a question, so we might have something coming from her. It's a lifeline. I like it. Anybody else have a question that they want to put forward? And again, you can ask about, yes, go ahead, Jeffrey. Jeffrey and then Lisa.
Thank you. So we have a group-based trauma-informed intervention that's yoga-based. And our argument is that that because of the group practice and the mental and the behavioral health benefits and other health benefits that come when people show up with high rates of participation, that if we co-locate that intervention at a community health center, that people who wouldn't otherwise utilize the services right there in their neighborhood would become familiar with and feel like the health center is a safe space, and that it would result in increased utilization of health services by people who otherwise have medical mistrust and other barriers. So is that the kind of, when you were saying systems change, I was curious about that.
Thank you, Jeffrey. I'm going to help you and say that you want to phrase that about the benefit to the people, not to the system, even though it's a systems change. So if you can think about putting
better health outcomes,
better health outcomes for those folks,
because they're accessing,
and an innovative practice. So I would encourage you to look at that specific strategy.
Right.
Lisa.
Oops, you're on mute, Lisa.
Hi, thank you. This is really helpful. If we end up having follow-up questions, it seems like Sylvia is our best bet. And I just wanted to check, are you open? This kind of back and forth is super helpful. Are you open to that, or should we be just thinking of straightforward yes and no questions?
No, we're here to help you.
Thank
Anything
you.
you need.
Yeah. We can't write the proposal. But
yes, exactly.
And we are capturing the answers to these questions and also questions that people will ask and make that available in the frequently asked questions and add those there. So you'll get these questions, and obviously you can rewatch the video to go back and see what folks have asked and how things were answered. And please feel free to reach out to Sylvia. I'll be providing her home address. No, I'm just kidding. Are there any other questions? We've got about a minute left. I want to make sure that you don't leave here with a question that you didn't get to ask. Right.
Really give it your best. There's a lot of people, as you can see here, so I'm imagining this will be fairly competitive, unfortunately. But just think of those great ideas. We are here to help. This isn't meant to be a scary process. We're trying to make it as easy as possible, really, to just fill in the gaps and get some good work done. If you don't get chosen, it's not because you're not doing great work. Know that. And there will be funds down the line to do something similar in the next, year in and year out. So These aren't the only dollars. There'll be other times if it's not the right time right now.
And if anyone is wondering, you know, there were 100 and something people here. There are 43 possible awards out of these 4 strategies. So you've got a, you know, looks like 50% chance there. So I would say to you that's better than any grant proposal you've ever written. So please put forward your LOIs. We look forward to hearing from you all. Thank you so much.